I feel like we live in times where, I don't know if it's just that we're collectively where we seem more sensitive than we've ever been, or it's just that the stimuli is more aggravating, more irritating, more inflammatory than it's ever been. What do you make of this complex milieu that we have seemingly inherited?
I don't think it's either. I think that we live in a world where, from like the emotionally sensitive side, the world is hard right now. Like it's just a difficult place to be. I think people just in general, they look at emotional sensitivity as a huge liability and a weakness, and it's so people have to stuff it down. I think people probably always been as emotionally sensitive, but no one's really talked about that, or talked about how a highly emotionally sensitive person is wired differently, or talked about the incredible strengths in emotional sensitivity. So I neither.
There's this tenor of heightened sensitivity, at least like on social media, but I don't know if it's like what direction is it, like just the fact that the rage bait is ever more in our faces, ever more present than it has been in the past. Like legacy media has always had that "if it bleeds, it leads" mandate, right?
I've never heard that. That's true though.
Yeah, it's true. I mean, I'm coming from a background of like, working in media many years ago at this point, but yeah, I mean, like whether they are cognizant of it or not, like the legacy media has long exploited our negativity bias, right?
Yeah.
And so I feel like social media does an even better job of that.
Yeah, it does.
So are we more? Is it that? Well, what's it doing to our mental health?
Well, here's the thing. I don't think being too sensitive, for the people that you were talking about, like who are concerned that they're too sensitive, I think there's a lot of people that feel things quickly and deeply and for a long time. And that's actually can be a wonderful thing. I think sensitivity is like a huge strength. If harnessed correctly, it can be an incredible strength. I think my sensitivity has made me a better physician and a better partner and a better parent and a better person. But then when you are constantly inundated with like this negative social media, or just like other people constantly putting outside and external stuff upon you, and it's hard for you to emotionally regulate that stuff, I think it feels like a huge liability because emotions can be so overwhelming in that moment.
It's so true. Yeah. It's like you can do your best to isolate yourself from it today, but it finds you. It has a way of finding you.
It will for sure find you.
So why did you write this book?
Because I'm emotionally sensitive.
You are?
Yes.
How are you doing right now?
Fine.
You're doing fine.
Good.
Okay, that's good.
Yeah. So far, so good. Don't say anything weird, though, because I'll start crying.
I don't know. It can happen. This is the genius life.
Okay, well, then just like work past it or maybe cut it. But I feel like I wrote this book because for years and years, I have seen patterns with my own patients where I've seen high-achieving people that have complained, like everybody says I'm too weak, I'm too sensitive, that I'm too fragile, that I can't handle big things that are happening in my life. And after hearing that over and over again, especially like that's what I've heard my whole life, you start to believe it and you start to internalize it. So this was my way of kind of looking at the neurobiology and seeing, are you actually wired differently if you're highly emotionally sensitive? And then what do you do about it if that's the case? So it's been a 3-year exploration of this space because there just isn't anything about that online or anywhere.
It's so true. So you would describe yourself as being somebody who's highly sensitive?
Yeah.
How does that like show up in your life?
Well, I feel like whenever I'm in any sort of situation, I'm taking in a tremendous amount of data. So my brain is working overtime and filling in gaps. So before you even start talking, I'm already looking at your face and I'm like, he doesn't look totally happy. Am I doing something weird? Am I like right now I'm sweating? It's just like I'm very sensitive to all of that external body cues, tone, things like that. And my brain, because it's so good at doing this, it'll automatically attach a negative spin to it. So the fear of like rejection or criticism is where that stems from. And it's from a concept called rejection sensitive dysphoria. And that's something that a lot of people with ADHD, almost 100% of people with ADHD have some facet of that. And so I am just very conscious and aware, like If you're putting out anything, my brain is already scanning and being like, is there any rejection? Is there any criticism? Watch what I'm doing. And that's I mean, every moment from the time I wake up to the time I go to sleep, that's what I'm doing.
Is it like a form of hypervigilance?
Mm-hmm. I think so.
Interesting. And can you say it's comorbid with ADHD? Is it a feeling or is it a diagnosis?
RSD?
Yeah.
I think I can't call it a diagnosis because it's not in the diagnostic criteria. So it's not there yet, but I think it's a constellation of symptoms and it's a phenomenon, a neurological phenomenon that you see present in ADHD quite often. You can see it in other things, but I think when I'm explaining it to people, it goes hand in hand with anything that experiences emotional dysregulation. Like if you have a hard time managing your emotions because they feel so overwhelming and big and at times crushing, a lot of times when you start asking other questions, you figure out like this is where it's coming from.
Is it like a nature or nurture thing, or is it some combination of both?
I feel because ADHD is primarily genetic that it's probably hardwired. And the fact that I have a son and he is built just like I am, I'm seeing all the same stuff. So it's interesting because now I can zoom out and I'm seeing this little person who coincidentally just has my same face. We look alike too. But it's like I'm watching myself in him.
Yeah.
I guess that doesn't help with nurture because I'm the common variable.
Well, yeah. I mean, you're raising him like obviously a certain way, but I would describe myself as a sensitive person.
Okay.
But I wouldn't describe myself as somebody who's like too sensitive.
Okay. Where do you draw the line?
Well, I mean, rejection hurts. I've been rejected many times in life, and you know, it always stings. But I always feel like I've got a pretty good, I don't know. It's like the confluence maybe of I'm pretty self-assured. I know my strengths. I also know my weaknesses. I have a confidence about me. I feel very like my locus of control is internal. Like I feel like I have agency in the world.
Okay.
Things might not always go my way.
Sure.
But I have the ability to affect my outcomes.
Okay.
And so that served me pretty well, I suppose.
I have all of that. And I still have that. I think the way that when I'm looking at that as a phenomenon, the way that I look at highly emotionally sensitive people is quite literally the difference in how they look at emotions in general. There are some people that they look at emotions and what it feels in their body, and they can logically go through the steps like, this is what Max is doing, this is what Sasha's doing. There is no rejection or criticism happening here. Move on. And then there are other people that you look at what Max is doing, you look at what Sasha's doing, and instead of there's a lag. And in that frontal lobe where you're supposed to have judgment and decision-making and processing, and that emotional amygdala, my amygdala is popping off and causing a ruckus before my frontal lobe can catch up. So now, all of a sudden, I'm feeling stuff before I can process and logically think out, like, there's nothing here that I need to. And sometimes it takes me 45 minutes, and then I'm like, that was nothing. But my body is still feeling it before.
So would you describe yourself as having like a higher just baseline level of arousal? Maybe that's what it is. Like, whereas the same stimuli for you might tip you over into a state of
overstimulation.
Overstimulation. I was going to say hyper arousal.
Yeah.
Whereas for me and others, that might not be the case.
It's possible. Like there's certain things that I feel like I'm hyper aware of. Like sometimes with like tiny repetitive sounds or things like that. Like there's other sensory stuff that maybe to some degree, but it's hit and miss. But this is just like within that emotional context. Everything else I can kind of manage or drown out. Emotional data for me, that's what's difficult for me to wrap my brain around sometimes.
Is this what some people describe as neurodivergence?
So I think neurodivergence is more like an umbrella term for anything that falls like ADHD and autism and sensory processing. And, that was in the 90s, that was like a psychology term to encapsulate all of that stuff that wasn't neurotypical, which also I don't love that term. But that was a blanket term.
Got it. And so it's like kind of like outdated at this point?
It's not outdated. It's just that it doesn't give me a lot of clinical data because I don't really know where the line between neurodivergent and neurotypical kind of, like there's just such a wide spectrum of neurodivergent.
Casts a huge net.
Yes.
Yeah.
So I don't know. This.
Yeah, that makes sense. So are there ways in which you show up with regards to like, for example, your self-care that helps you better manage like these big emotions?
Yeah, I think number one, just knowing that this is a complex phenomenon. So rejection sensitive dysphoria is an intense emotional response to real or perceived rejection or criticism. So you feel it, and then your brain has to kind of catch up with it. And it's interesting because most of the people I've explained this to, they're like, oh, I know exactly what I'm talking. You might be the only person I've ever met that doesn't know what I'm talking about.
Me?
Yeah.
RSD?
Yeah.
I've never even heard of it.
Yeah. But I'm asking just for my own
please.
knowledge. Does that feeling sound familiar to you at all? Or is it like this is completely unfamiliar to me?
Well, it's interesting because, there's a selection bias here, right? Like I've been rejected a bajillion times in my life.
I'm a pro.
I have a degree, I suppose, of strength, which is why I'm here, right? Which is how I've been able to persevere, over the past few decades and make it out on the other side and have a thriving podcast, for example, having books that do well.
Yeah.
I'm an entrepreneur. I'm self-made in a way, and that is not easy.
No.
All people see typically is like they see you at your successful point.
Yeah.
But there's a selection bias there. Like they're only seeing you at that point. What they're not seeing is the iceberg, is the parts of the iceberg that are below the surface of the water, right?
Yeah.
So maybe I just have like a degree of unusual strength or what have you. I don't know.
Possible. So like when you deal with rejection or something like that.
Yeah.
Is it like, okay, move on. Like that's not going to get me down. Let me stay focused on my goal. Move on from that. Let's get into your
background. I love this. I like this. I like where this is going. It definitely stings. I'm trying to think of the last time that I was like rejected. Yeah, it's not pleasant. It's like, when I get, for example, if I see, I don't know, this might be like a really boring example, but if I see like there's a big health conference happening, like a big wellness conference, and I'm not like invited to be one of the keynote speakers, and I see like people who I know are way inferior to me and my rigor and my efforts and my communication skills and whatever, and they're there, they're keynote. I'm like, what the hell, man?
Yeah. And then what?
But then,
like, do you chew on that for an hour? Do you chew on it for a day? Or are you like, okay, because nobody likes rejection. That's like, no one likes rejection. No one likes criticism. That's not a thing. I'm talking about if that situation happened to me with that health conference, which it has, I will feel it physically. I feel it like someone has like punched me in my gut. And then sometimes I'm like, I might be sick. And then I have to think back and be like, what happened? What am I feeling in my body?
Yeah. I guess I don't see it as like, my inner chatter is not, well, maybe I'm not good enough. My inner chatter is like, well, they're stupid.
I don't think you have this.
Yeah, I don't think I have it either. But I guess going back to the selection bias, I think it probably like people that are very sensitive to rejection probably don't tend not to go into entrepreneurship. And in fact, you probably know this, whether or not there's data on this more than I do, but like, don't people who gravitate to entrepreneurial roles, don't they tend to be more prone to ADHD?
Yeah.
And they do, right?
Yeah, which would negate the thing about RSD, because if you're thinking about 100% of people with ADHD have some degree of RSD, a lot of them. I mean, we're out here. We're doing all the things. We're just getting intermittently smoked by these like episodes of like rejection or criticism, and it's difficult, but that doesn't stop me from it has at times, but eventually I'll get to the point. It just makes life cumbersome when you're like trying to sidestep. Oh, did I move away from this microphone?
No, you're good.
Even with this?
No, you're good. No, we like the interpretive dance.
Yeah.
And it's a podcast, but we're a video podcast.
Okay, great.
No, this is very interesting stuff. So I've probably gravitated to my entrepreneurial media, entrepreneur path because of the resilience that I feel that I have. Although I wouldn't describe myself as somebody who, like, I probably have subclinical like ADHD. It's hard for me to read books. Like, I've never finished a book, or it's rarely the case that I finish a book.
Okay.
But I do tend to have a brain that loves novelty and like hates routine. Yeah. In many regards, not in all regards, but like I like my workout routine. I like my diet to be routinized. But yeah, so that's probably why I enjoy entrepreneurship. What about for people who are stuck in they're sensitive, but they're not currently harnessing the sensitivity that they have for productive purposes?
I mean, that's a lot of people, because a lot of people they've been told over and over again, like, that sensitivity is going to have a bad outcome for you. Like, you are too fragile. You won't be able to toughen up and get through this thing. And so a lot of people, they end up giving up what they want to do, or they find a way to like sidestep it for a lower goal. So I think, number one, recognizing that emotionally sensitive people and people with ADHD and outside of ADHD who have RSD, that there is a name for it. Like, this is a real neurological phenomenon that happens. And then there are tools that you can use to manipulate those moments, like in that moment and over time, that you can take that situation so you become less reactive. And I think that's what took me 3 years of kind of pulling from every area of psychology and psychiatry and neuroscience to figure out, like, what does help in that moment and what does build resilience over time. So
how do you do that? How do you build the resilience muscle?
You get my book and I'll tell you.
You gotta share with my listeners.
No, I mean, the reason here's what my answer to that is. In terms of how you can do that, overwhelmingly, the first step is knowing your patterns, which I think is really important, because a lot of people, it's almost like this stuff is happening to them, and then they can't gather that data and extrapolate and move forward and be like, this is what my body was doing, this is what my brain was doing. And so it just feels cataclysmic every time it happens. So understanding your patterns, what are your triggers, what gets you into that hyper aroused state, and how do you get out of it? Number two, knowing that this exists, because I think that also allows you that ability to kind of separate enough, like, I know this is a phenomenon, let me watch it without that judgment and shame that comes with it. And then three are the actual tools, and that depends on the kind of moment. So are you going to be like, if you're pulling from like DBT principles, are you—
what's that?
Dialectical behavioral therapy. We use it a lot for things like borderline personality and generalized anxiety and things like that. But are you trying to just accept the present moment? Like, I'm going to look at this neutrally without any sort of judgment, like, and just kind of sit with it and kind of gain resilience in the fact that nothing bad is happening to me in this moment if I just accept what's happening right now. Okay, this is my entire body feels like something physical is happening to me. How do I get this energy out so I can kind of move forward and let my frontal lobe kick back on? Do I need to utilize movement or some other skill? So it depends on the situation, but utilizing these tools and then knowing what is the point where you start to think about, like, if these tools aren't working in the moment, or I'm still feeling significant amount of distress and I can't apply the tools in real time, when do I need to look at medication? I think that's the path. That's the path.
what kind of medication for somebody who's just uncomfortable with rejection, which feels to me very, very human, very normal? Like what you would prescribe, like a medication?
Again, not somebody who's just sensitive to rejection. It's somebody who has this overwhelming sensitivity to rejection or criticism that's limiting them from doing things that they want to do, or they feel it very viscerally. Then you use skills. If skills don't work, there are things that kind of help. Like, for example, if this is coupled with the ADHD and you're feeling that strong emotional dysregulation, which, by the way, not part of criteria, so that's a huge problem. But if you're feeling all of that, what do you do when those tools don't work? You can use an ADHD medication that kind of helps. And sometimes you can use things like stimulants. Sometimes you can use things like non-stimulants, which give you a more consistent baseline level of control. And there's some that are specifically indicated for this RSD. Then, you can look at, is there a hormonal component to this? And then do you need to look at HRT? Is there like an anxiety or depression underpinning? Do I need to look at those medications? So there's different, depending on what the situation is, and kind of looking at all of that data together, then you can kind of figure out, this is where I need to go. But I think if people can recognize it within themselves, they can start these conversations with their physician.
That's interesting. Have you looked into at all like psychedelic assisted psychotherapy?
I have, but not in the context of this.
Well, because that to me would seem, there's all these studies now looking at, I can't cite any one in particular, but I see them pop up all the time where like, they'll compare one dose, in the right setting with the right therapist of psilocybin, for example, to 6 months of antidepressant therapy, like traditional classical antidepressant therapy, or smoking cessation. They found that, one single psychedelic session surpassed like 6 months of nicotine patch wearing as a smoking cessation therapy. So I'd be curious to know, if these tools can help, because what they do is they help you to kind of step outside yourself for a moment to kind of see where your patterns, your thinking patterns might be betraying you in some way.
Yeah, here's my 2 cents about that. I think that's a super exciting part of medicine. And like, objectively, full stop, I think it is. There's stuff there that I want to get into, but it's so tightly regulated and they're not good studies. So I can't tell you longitudinally what it's going to look like. I can't tell you what it looks like for specific things. So because of that, I can't, weigh in. Is that necessarily going to help? Is this consistent data? Is this something that with different things going on at the same time, is this going to help in that moment? But I want to know more.
Yeah, of course. Yeah. There's a lot of really exciting work. Robin Carhart Harris is one of the preeminent researchers in the space. I think Imperial College London, if I'm not mistaken, but he's done some really incredible work there. So definitely worth, and we've had him on the podcast in the past, actually, worth looking into. So if somebody feels that they're too sensitive, is there a way, obviously building that resiliency muscle, I think, is so important, but what about funneling it into productive like channels? You mentioned movement, but what else is out there?
Well, I think, first, what do you define as a productive channel?
Anything other than rumination and just allowing those negative emotions to work on you.
Right. I think that truly what we're looking at is that when you are so activated, when you are dealing with big, heavy, scary emotional data and your brain isn't great at processing it, if there is a way that you can calm that down, even slightly, you can pick up and do what you need to do as a secondary thing. This is the limiting factor. So I think that, like doing things like movement, really it's not because the end goal is movement. It's because it's almost like a tool to kind of help you process through, and I don't want to say distract your body, but essentially that's what you're trying to do. You're trying to funnel that energy and move it into different places so that you can focus and allow your frontal lobe to come back online.
Interesting. What about creativity? Like, do you see higher levels of RSD in people who would describe themselves as artists, for example?
I think there's higher levels of ADHD in people that are artists. So probably.
Yeah, I mean, I would describe myself as an artist. Whenever I've like,
You don't have it. We already established that.
I don't have it, but I am sensitive. Like I'm very like open to experience. I'm like when I'm listening to certain kinds of music, like I'm prone to getting goosebumps. I'm prone to the sensation of awe and wonder when looking at sites that inspire me, grand vistas, beautiful architecture, things like that. So I'm like, I would describe myself as sensitive, in like a productive way, I suppose.
Okay.
I don't know. Talk to me about ADHD. There's a lot people, it's something that I think many people struggle with.
Yeah.
At what point was it rebranded? It was like originally ADD, then it became ADHD. What's the story there?
It's a dumb story. I don't think they did a good job rebranding it. I hate it. But basically from the DSM-4 to the DSM-5, they went from ADD, which now we're considering ADHD inattentive type, and they moved ADD to ADHD. And now ADHD is broken into 3 types. There's inattentive, hyperactive, and then combined type. So the reason I have beef with that is I think the name is confusing. ADHD, attention deficit hyperactivity disorder. I don't think everybody presents as what you would think of when you think of hyperactivity. And so that gets confusing. So for a lot of people, and like when I'm saying people, I'm also talking about some physicians, they will be less likely to diagnose ADHD because they're like, you don't look hyperactive. So it can't be that. So I don't love that. I also don't like that they focus so singularly on the attention part of it, because I think it encapsulates a lot more than that. I think, with ADHD, you're dealing with a dysregulation disorder or a dysregulation trait, something that is dysregulating not only attention, but also emotions and sleep and appetite and energy and motivation. So all of that, I think, I don't think you can stuff that into ADHD's name.
No, and the names of these conditions do have consequences, right? I mean, PCOS was just renamed.
I know.
Which is a great thing, right? Can you share a little bit about that?
PMOS, right?
I believe so.
Yeah. I think just the renaming of things to encapsulate a wider net. So you're not, because when it was called polycystic ovary,
many women don't have cysts.
Don't have cysts. Yeah. And so then you're just like, what? Okay, well then this is a stupid name. Then this is like stupid in terms of like both for the physician, because some physicians aren't going to have that adequate kind of knowledge base, especially if it's not within your wheelhouse, if you're not an OB-GYN or if you're not directly dealing with it. But also for like in terms of the general public, a lot of those initial dialogues and conversations about your healthcare, they're happening with your family and with your friends. And that's when you figure out and do enough reality testing to be like, okay, should I go and see a doctor? Should I go and do this? But the first ones you're turning to are really, you're asking the people around you, like, should I go to the doctor for this? What is this? And so that's why names are so important, because they're not just for the physician or for the diagnosis, they're for the public, for the people who use these words.
Totally, yeah. I mean, as I mentioned, I've always felt like I had like subclinical ADD. Mm-hmm. I would not describe myself as somebody who's like particularly hyper. Mm-hmm. So ADHD doesn't seem like it would fit as well, but I've always struggled with applying my attention to topics, subjects that I'm not obsessively interested in. Are you the same way? You describe yourself as somebody with ADHD.
Yeah, I am. I think that my nervous system operates on novelty and urgency. And like if a deadline is coming up, I could do like 3 weeks of work in like 3 hours if I need to. Like it just kind of depends on what pushes me in that direction. Whereas if I know, like, and I found this when I was studying in medical school, like if I know the correct way to go about this is to study a little bit every day. Never been my deal. Like I would want to study, like as soon as I started getting panicked about it, that's when I would start.
Big procrastinator?
Yes.
Me too.
But again, I think that some of that procrastination is emotionally based. I mean, there was an emotional component of it that I was afraid that I would do badly, or I was afraid that the task was too big, or I was afraid that it was overwhelming, or that I would feel badly about myself if I started that. So I'd be like, whatever, I'll deal with that tomorrow. And that's what kind of kicked it down the road.
Interesting. It's funny because like I have had a lifelong passion for health and I would even say medicine. Like it's kind of weird being I'm not a medical doctor, but I've always been passionate about medicine, but I didn't go into the field of medicine because of this sense of attention deficit that I feel that I've always had, where my grades suffered because I would get A's or B's in the classes that I was really interested in, but then I would get D's in the easy classes that I had no interest.
Didn't care about.
Yeah. So was that something that like, can you relate to that? Is that something that you experienced?
Yeah. And I think that's hard because when you get, so my trajectory was that I diagnosed with ADHD in 4th grade. I was put on medication for it, did really well from 4th grade to 12th grade, did well enough that I was able to enter med school right after high school. So I'm like doing this combined grad school program, but then I stopped taking my medication. And I was like, I fully thought I had a stroke. I was like, I don't know what happened here. And so it became something where a lot of those, I just wasn't able to push myself towards things that didn't capture my interest. And I was making a lot of errors that were just careless. They were like I would get 100% on the first part of the page and I would forget to flip it over and I would turn it in. And so like things like that, and my grades would suffer and things like that. And it's when I started to look at that cumulative data, I'm like, there's something here that even with my best efforts and pushing 100% of my energy into, I won't be able to continue to keep up with this. And so that's when I re-explored kind of diagnostically what is going on with me and what medications could potentially be right for me. And I think I did need them in medical school. And then my relationship with medications has changed. But because I think I focused on that period, I built enough collateral circuitry and hacks and things around having a medicated brain that it sustained me kind of moving forward.
Interesting. Is medication the only answer for somebody struggling with ADHD? What are some other means of treatment?
So the way that we treat ADHD is twofold. You can do behavioral management or you could do medication management. Behavioral management, you're working with, trying to better handle executive function tasks and things like that. So the set of skills to make your brain go from point A to point B, that's executive function. That's what you need. So looking at your patterns, filling in the holes, doing things like that. Also supplementing with things that are good for your body. Good diet, good exercise, good sleep is huge. So all of those things, if you plug a lot of those holes, a lot of that dysfunction becomes more manageable. And you don't have to go into the road of medication. Now, there's some people, and I'm one of those people who I wasn't able to do that, even though I did try very hard to, like in med school, I was like, I will be diligent about my sleep. I will be diligent about my diet. I will be diligent about every controllable factor, and I still could not get there. So there's some people that even if they do all the right things, they still need some sort of medication to kind of help reorganize things. And what I tell people is like, how you respond to medication, there is a chance that you won't need it long term, that you build enough and you figure out patterns and pathways that you will not need it long term. And there's some people who do. So it just kind of depends.
It's kind of making me think of like the GLP-1 drugs and how, I'm certainly not anti them, but how they can be used as a jumpstart of sorts for some while they're on the path to better learning about their, satiety patterns, hunger patterns, resistance training, exercise. I know some people, or I've met recently a person who had a newborn. It was his first kid, and he gained like a ton of weight in the process. But he had this history of like being in good shape and working out, but he just all of a sudden just gained like 30 pounds of fat. A lot of it was like visceral fat. And he did like a low dose of one of these medications. Like, I'm not saying it's positive or negative, like his approach, but like no judgment in either direction. But he used one of these drugs to like shed the weight, and then he came off of it. He came right off of it because he had already known like how to, eat properly, eat healthily. It's just all that had gotten away from him in the process of like becoming a dad for the first time. And so it's interesting that these drugs could potentially be used in a similar way.
Yeah, to help you build good patterns and to give you almost separate yourself from that internal milieu enough that you can do what you have been trying to remain consistent on. So it allows you to build those habits so that you can continue to execute them. Now, there's some people that even with that, it's hard for them to maintain consistency. So they need to be on medication. And so what I tell people is this is all such an individualized process. And the other thing I tell people is everybody, when they think about ADHD medications, they think about Adderall, Ritalin, Vyvanse, they think about stimulants. But there is this whole sea of non-stimulants that you could do, which, they're non-controlled. They have a lot of them have 24-hour coverage. They can be used for multiple things at once. Like some of them are antidepressants and ADHD medications. Some of them are blood pressure medications and ADHD medications. So there's a whole world of stuff you could explore. So you don't have to think that if you are thinking that you have ADHD that you need to immediately be on a stimulant, because you don't.
See, part of me wonders, this is like maybe the cynical side of me wonders, like, do people that quote unquote need these drugs need the drugs so that they can shoehorn themselves into the one size fits all education system or the 9-to-5 desk job? Like, is it possible that just by applying themselves to a more maybe entrepreneurial path, to a more bespoke educational style, like a Montessori system, for example, which I recently learned about, like that maybe they would be able to thrive without the drugs? Like, have you ever seen that?
But that's such a privilege. For people to have those to go down the road of a Montessori education, that's private education. For people to go into the world of entrepreneurship, you have to have enough financial capital to sit and do that and take those risks. So there's some people who aren't afforded those luxuries. And so, yes, if they could build an environment that would perfectly sustain them, I don't think people would pick a 9-to-5 job, generally speaking. They would pick something that with like a little bit more flexible structure where they could thrive and they wouldn't feel as penalized for things that, their brain doesn't naturally move towards. Like, for example, people with ADHD have delayed melatonin onset in their brain. So their natural sleep-wake cycle is a little bit off. So instead of being like, I'm going to feel sleepy at 10 and I'll wake up at 7, it's like, I feel sleepy at 1 and I will wake up at 10 a.m. And that is where I'm happiest. And that's where I'm happiest for sure. But that's not where I'm starting stuff at 6 a.m. sometimes. So I think, to build a life that truly sustains your brain, it takes a lot of privilege.
Well, I appreciate that you validated that that thought that I had, because I went to a fairly typical high school, college, and I definitely struggled, and I'd never taken any medication or anything like that, but I can imagine how if the education was a little bit more bespoke, then I probably would have done better than I did. Mm-hmm. Why is it what is it about stimulants that how do stimulants work? And is I don't know, is caffeine something that helps people with the ADHD phenotype?
Yeah. So there was a study that came out of WashU in December of 2025. So a few months ago. And it was talking about how do stimulants actually work. And stimulants work in two different ways. Number one, they work on alertness. And two, they work on motivation and moving you towards reward. So with alertness, it's not that it's giving you more energy, which is what everybody thinks. It's not giving you more energy. It's covering up your sleepiness signals.
Interesting.
So if you are, nothing is going to give you more energy outside of sleeping and resting and getting more energy that way. So if you're chronically on this sleep deficit, stimulants will feel like it's less effective. I'm tired. This stimulant isn't really working as much. So that's how stimulants work. So by the same rationale, caffeine could work to some degree, but when they've done head-to-head studies with caffeine and stimulants, the amount of caffeine that would be equivalent to what a stimulant does, because a stimulant is going to bind that receptor tightly in comparison to caffeine, which is kind of on and off. It would be such a high dose that you'd be jittery and sweaty and you'd shit your pants before you get a chance to get that ADHD benefit.
That's not good.
No.
Man. Do people with ADHD typically struggle with sleep? Like, do you have sleep issues?
Yeah, all the time.
Huh.
I just don't want to go to sleep. It's boring.
You just don't want to go to sleep?
I don't want
Wow,
to.
sometimes I feel that way too.
I know. Ooh. Okay.
Cray.
Yeah. You better just like reevaluate your whole life and then dial it back and think about RSD again.
That's very interesting. So what do you do? How do you like, how have you found to, because you said, so, I mean, sleep is crucially important.
Yeah.
It's crucially important for so many things.
Well, I'll tell you, but it's embarrassing.
I want to know.
I mean, it's not embarrassing, but it is very specific. I literally feel like that area of time when I have decided to go to sleep, like I do all my nighttime stuff, put in my retainers, ready for bed, get into bed, put my phone away, because I'll do that. I am flooded with the best ideas I've ever had and like this huge wave of energy. And I'm like, I don't want to go to sleep. I want to do this and this and this. And I will think about stuff and be like, don't forget this. Don't forget this. Okay, if I think about it more, I'm definitely not going to forget it the next day. And so I just like right before bed. So now what I've done, I have the zoomies.
Like my cat.
It's exactly like your cat. But I now, in order to just like give myself the just relief of not forgetting stuff, I just write down not on my phone, on a pad of paper by my bed, and I just dump out everything. And then the next morning I look at it, I'm like, some of it I'm like, that's an awesome idea. And some of it I'm like, what was wrong with me this time? Like it'll be like character name, London, and then nothing.
Wow.
I'm like, I don't even remember where that thought came. And for what? Who could know? It's a mystery.
And that helps you get to bed at a more reasonable time than you would otherwise?
Yeah. I'm talking like 2 hours.
Huh.
Just because I'm not feeling anxious. Because I know that if I come up with something, I can just write it down. But then I don't. I don't feel that urgency.
Interesting. No, I can relate. I get some, I typically get really good ideas like when I'm just like in those moments, like right before I'm about to pass out. Mm-hmm. That happens to me quite a bit. You mentioned that melatonin is involved. Like,
yeah.
What are your feelings on melatonin supplements?
There was a lot of stuff recently about melatonin where it kind of fell out of favor. I don't know. Melatonin is like what I think for people who are off in terms of their shift wake cycle, not necessarily like internally with their shift wake cycle, but like, you know, they're moving from days to nights or stuff like that. That's where I've seen it be used. I don't feel strongly one way or the other. That's not something I'm recommending for my patients, though, as a first line.
But it is pretty reliable for, like, for example, treating jet lag, like a low dose of melatonin, like 1 to 3 milligrams, when your circadian rhythm is disrupted. Mm-hmm. So it might potentially be helpful.
I haven't found, in just, anecdotal data from seeing my patients, I haven't found a huge difference in kind of before versus after, which is a little confusing because it's delayed melatonin onset internally in your brain. So you'd think that an exogenous melatonin would help, but I don't know.
That's what I think, yeah. Huh. What about weed?
Okay. I wasn't prepared for this conversation. Here's my 2 cents about that. And this is probably a little bit controversial, but I feel like there is a reason why people keep going back to THC in terms of like, it truly does. It helps with appetite. It helps with sleep. Some people say it helps with anxiety, although there was a recent study showing that it technically does not. So when people come to me and they're like, I'm using this for sleep, I understand that there's something there that it is making easier to some degree. And then it becomes a conversation about like, well, let's see, are there any other options of stuff we could use that may be easier for you in the long term? And I again, this is like one of those things that if I had good long-term, well-studied information. I could give you like a cut and dry answer. We don't have that.
Yeah, but absence of evidence is not evidence of absence. And I'll tell you, like,
It's true.
I can relate to a lot of what you said. Like, sometimes I feel like, not every night, like if I've like exercised my body earlier in the day and built up sufficient sleep pressure, I find it really like I get tired at a reasonable time and I go to bed.
Yeah.
But on other days, I feel like it's really difficult for me to turn off my brain. And I will say, like, I hate being high on THC when I'm conscious. Like, I do not like THC during my waking hours.
Yeah.
But I have found it to be incredibly helpful, like a low dose for me personally. Like, 20 minutes before bed, I take like a gummy that has equal parts, and no affiliation with any like THC company or anything like that, but it's got equal parts THC, CBD, and CBN. I think I take like between 2.5 to 5 milligrams of THC, the same dose of CBD and CBN in this one gummy formulation that I have, and it works. No pun intended, like a dream. Like it, I don't feel anesthetized, or however you pronounce it. I don't feel like numb. I don't even feel particularly high when I take it, but it does put me to sleep. So I don't know, maybe something worth looking into.
Yeah, man. If I had a lab and I could run those studies independently, I would do that. It's one of those things that truly I feel like long-term, I want to know what those studies look like. Sleep is so vitally important. I know that. But if now with that gap in knowledge, and again, it's because it's not a federally legal substance, we don't have those good, robust studies. Am I trading something that down the line I'm going to find out causes cognitive difficulties? Like, that scares me. Don't want to deal with that. Especially, the data that we do have at younger ages, like when they start getting a hold of THC and using it chronically, how it increases that risk of schizophrenia like ninefold. 9 to 17 times fold. So it's just like this huge, big numbers of we just don't have great data. So then it's like, I don't know. I'm just too scared.
No, you're right. I mean, that caution is important because I do feel schizophrenic when I take it, like, and I'm like if I took it in the middle of the day, like I would not be fun to be around. But
I'm super paranoid.
Yeah, no, I get super paranoid. I literally, like, my internal like world, I start to feel like everything is off. So that's important. There's also a potential impact on fertility we've learned recently on the show with THC. I think mainly in men, but I could be wrong. I don't know.
There are things that we are going to, especially with this like kind of patchwork legalization that we have in terms of like some states have it, some states don't. I think what's going to happen is eventually this is my prediction, we're going to start to lean more on the side of legalization. And, if we do get to a spot where it's federally legal, we can start getting those good studies, robust studies over time. But I think there potentially will see there has to be some sort of correlation with something. So I'd like to know what it is.
Yeah, true that.
Yeah.
Well, who'd you write your book for? Like, who is the ideal reader of the book? What do they stand to gain?
Yeah. So I think this is for the people who feel things quickly and deeply and for a long time, and they feel like those emotions can sometimes be a little bit overwhelming for them. This is a book that is not about making you less sensitive. It's about giving you more control. So that's who it's for.
Anyone who's ever been told they're too sensitive.
Yes.
Were you told that?
Yes.
Man. Yeah, but it's a good thing, man. I bet the world's greatest artists, like, I bet there's a commonality there that they feel things.
Yeah.
That's important. It's just the problem is today that social media like exploits that in people.
I know. And also like the world we live in, we especially like I have a daughter and a son, and already in like socialization patterns of how like not with me, but like how the world treats my daughter versus how the world treats my son. Like, my son is supposed to buck up and be tough, and he's 6, and be a tough guy, and he's so tenderhearted and sweet and sensitive. And so, seeing that kind of stuff, I'm like, the world is not giving him a place to be sensitive or to talk about emotions in like a real valid place without being told like, stop crying, toughen up, it's no big deal. And it's just, so I think it's an important thing to start incorporating into our conversation, because I think sensitivity it can be wonderful. I think that true human connection and emotional intelligence, it starts with emotional sensitivity.
It's interesting. And would you say that it transcends sex?
Yeah.
And it's just that boys are taught to tough it up.
I think I was told to toughen up constantly. But I think, as like, if you were to look in a gendered fashion, boys specifically, they are told like, you do not cry. This is not what men do. You don't. And I've heard it with how people talk to my son. And so, it's just very different seeing. It's wild having a boy and a girl. The world treats them very differently.
That's so interesting. I mean, I grew up in a family. I had 2 younger brothers, and we were not. My mom was a very sensitive person, and my dad was kind of like, my dad was a very masculine guy, but masculine like in a different way. Like, my dad was an artist, loved music, loved to paint.
Yeah.
Growing up, wasn't really that into sports or anything like that. Was into fashion, like dressed really well. And so we weren't taught to suppress our emotions, but we were rewarded. Conversely, we were rewarded for being brave. Like, my mom would always like go out of her way to point out like a moment of bravery or courage whenever me or my siblings would display that. She'd always be like, "Wow, you're so brave, so courageous."
But I think that's great.
Yeah.
I think being brave is a wonderful thing, and celebrating those moments is wonderful. But I also think, like, when a kid, instead of having this shame-based schema around, like, I'm feeling things and I can't feel it and I have to push it down inside me, if they are able to have that verbiage to be like, I'll give you an example. I was rude to my son. I didn't mean to be, but like, he wouldn't get out of the car and I had to leave. And all I said is I said his name loudly, and he got out of the car, and I could tell that it upset him. So I was like going to apologize. He turns around and he's like, "Mom, you hurt my heart." And I was like, "God, this is awful." And so, but I understood what was happening in that moment, that he felt hurt, that he felt like I was, and that was a moment of sensitivity. But I was so proud of him because he was using his words to tell me that. And I felt proud that he felt safe enough in this house to not be that he needed to bottle that up or feel like it was inappropriate to say it or talk about it, or it made him weak to say that something hurt his feelings. Like, I love that.
Yeah, I love that too.
Yeah.
That's cool. Wow. How old is he?
6.
He's 6.
Yeah.
Mom, you hurt my heart.
I know. And it's weird because he has literally my same face. So I'm like looking at him. I'm like, oh, so sad.
Wow. Well, thanks for coming out. This was
Yeah.
a fun conversation. And I implore people to check out your book. We do live in times that can make even the strongest among us feel fragile, but sensitivity can be a strength. Mm-hmm. So thanks for doing what you do. I've got one last question for you, but before we get to that, where can people pick up your book, and how can they connect with you on social media?
Yeah. You can pick it up wherever books are sold. Anywhere. And on social media, my handle is the Psych Dr. MD, and I'm on all of them.
On all the platforms.
All of them.
Love it. Well, the last question that gets asked everybody on the show: what does living a genius life mean to you?
Oh my God. Living a genius life means taking hold of your sensitivity, obviously.
Obviously.
Yeah.
Thank you guys for listening. Love you all. And sending love. Catch you on the next episode. Peace. Hey, if you liked that video, you need to check out this one here, and I'll see you there.